If someone with cancer is interested in trying Chinese medicine, what should they look for in a practitioner?
Well, especially someone with cancer, you want someone that is licensed and certified in acupuncture and also herbology, because both will be needed for cancer patients. Other types of discipline
Sports medicine.
like sports medicine, things like that, you can just use acupuncture. Also, oftentimes herbs is not necessarily needed, but for cancer patients, for sure, you need to make sure that someone is licensed and certified in herbology, and have some experience in treating these type of symptoms. They need to be versed in your condition, your cancer condition. So there should be someone who actually has some experience in treating cancer.
Is there extra training for in the acupuncture community?
Oh yeah, for sure. Yeah, there's certifications in our profession. So there are people who are trained to do that. They know what kind of acupuncture points to use, and what some typical conditions like symptoms, side effects associated with cancer therapy. So it's well documented. You can learn it. These practitioners.
I did not know that.
Yeah, know it. So it's actually.
So just like we have it I've done mine in sports medicine, extra training.
Yes.
I did not know that it exists
Right.
for.
So don't go to the cancer practitioner to get sports medicine.
But I feel like it's just yes. I think that's also a big misconception in the U.S. But that's just similar that like. If you have low back pain, you don't go to the dentist. So it kind of sort of applies to the same for our profession.
Right.
If you have sports related issues, go someone who has extra training.
So it's not like
specializing.
It's not that you can't, but they're like the GPs, like the general practitioner. So they're good at most things, and maybe they get away with it at certain things. But if you have a more more complex. You want a complex condition, you definitely, like in the case of cancer, you definitely want to go to someone who actually knows, have seen this thing, and familiar, right, with these type of condition. And the same with sports medicine. I will go to someone who's been treating sports medicine, as opposed to someone who sees one sports medicine condition a week, perhaps.
But I think the biggest difference here too, as well, is that once you graduate, because Chinese medicine is initially was originally for internal diseases.
Yeah, internal medicine.
Internal medicine. Once you graduate, you can treat any kind of internal medicine conditions. But for someone who's with severe, like cancer, you would go someone who has extra special training.
The problem is oftentimes in the United States, a lot of cancer patients may not come to you.
Yes.
And then so not that many practitioners have that much practice. Now maybe in other countries there is different, but here in the U.S. is not.
Yes.
And hopefully that's changing, and as more people seek these services, then more people are trained in it.
Extra training, yeah.